Hello, everybody, and welcome. Thank you for joining us today. We'll pause briefly to allow additional attendees to log in. Our Advancing Throughout the Year webinar series. My name is Lorena Muralles, and I'm a Community Health Promotion Specialist with the County of San Diego's Department of Strategy and Community Engagement, and I'm honored to be your moderator today. Today, we're grateful to be partnering with 211 San Diego as they guide us through the ways organizations can connect their services to their local communities and strengthen outreach through the 211 system. We appreciate the time and expertise that 211 San Diego is sharing with our partners today. Here's a quick overview of today's session. 211 San Diego will walk us through their role in connecting community members to essential health and social services, important information about the 211 resource database, how organizations can update or add their free services to the database, a partner spotlight from one of their super users, the San Diego Food Bank, as well as the Work Ready Hub and how it supports job training, education, and volunteer pathways. Finally, they will guide us through 211's community information exchange. We'll wrap today with a Q&A session at the end of the presentation. With the short time we have here together, our hope is to provide you with valuable information and resources. A few reminders before we begin. This webinar will not be recorded and your lines are muted. Additionally, AR note takers are not allowed. Closed captioning is available via transcript option in Zoom. Links and resources shared by presenters will also be posted in the chat by our team. Remember to submit your questions in the Q&A box with the button at the bottom of the center of your screen, and we will address them as we have time during our Q&A session. And if due to time constraints we do not get to your questions today, or you want to reach out to our team, you can follow up with us via email at the email address listed on the screen or in the chat. And with that, I'll pass it to 211 San Diego, Nicole and Simone, who may take it away.
Hello, good afternoon. Thank you all for joining today. My name is Nicole Blumenfeld, and I am Vice President and Data and Technology Solutions with 211 San Diego. And I'm joined today by Simone Williams, our Resource Database Manager. In my role with 211, I oversee our data and technology strategy, including the systems and that connect people to community resources, as well as oversee and support our resource database from kind of partner strategy to implementation. And a big part of my work is thinking about how we can use technology and information and really the information to make the connections easier and more effective for our communities. Simone leads our resource database and the team responsible for maintaining the thousands of community programs and services that 211 relies on every day. And she works directly with our community programs and services and ensures that, that their information, your information, is accurate, current, and useful for the people searching for help. So between the two of us, you'll hear both the broader perspective of how this information gets used across 211 in the community, and really the more practical side about how you and your organization can keep your information updated with our resource team. And so that is we'll go into a few more pieces about that. Okay. And I know we went through the overview, but I'll just kind of recap what we're going to do today. But really our goal is to give an overview of 211 San Diego for folks that maybe are not as familiar with 211 services and processes. But the goal of this is to spend most of our time on the resource database and really getting a sense of kind of the broader overview about how people can access services, and how you can keep your information current. We'll talk a little bit about the Work Ready Hub, and we'll do some different and show how to interact with the site itself, and then how to use the resource database in a couple of different searches. And we'll talk a little bit about the Community Information Exchange as well. So for folks that are not as familiar with 2-in-1 San Diego, we are a local nonprofit that has been in service for over 20 years, connecting San Diegans to the community, the food, housing, healthcare, and other critical services that our community needs. Our community connectors are available 24/7 and can serve people in more than 200 languages. And behind that phone call is also our resource database. And this is really the lifeblood and about most of what we'll talk about today, but that's the information where we can provide for our clients. It's the database that is online, it's the database that our agents use, it's the database that our partners use to look for those services to connect clients and individuals across the community. And there are some incredible programs all across San Diego, but it's our job, and the most important part is to really make sure that those services can be found by everybody. So whether someone calls or searches online, that information in the database is really the most critical piece of information we have. I will pass it over to Simone to continue.
So I really want to emphasize the point about the quality of resources that we have in our database and the quality of information that we have in our database with a simple example. So let's meet Maria. Maria calls 2-in-1 because she needs emergency food for her family and she needs it today. Our community connector talks with her, gets an understanding of what she needs, and searches the resource database. 3 nearby food resources come up. And on the surface, that might sound like a success. There's 3 options that Maria has. But finding a service in the right category isn't enough. The outcome of Maria's call depends on what those listings can actually tell us. So let's look at these 3 listings and results that came up for Maria. Listing A, it doesn't really tell us that much. We know that it's food assistance, but we don't really know what someone receives, who's eligible, when it's available, or what they need to do to access the service. Listing B is better. We have some information, but there are still important gaps. For example, people in need isn't really an eligibility standard, and most weekdays isn't enough if Maria needs food today. So now let's look at listing C. We know exactly what she gets. She gets a 3-day emergency food box. We know who's eligible, any San Diego resident, and there's no documentation required. We know she can walk in without an appointment, and we know the exact hours. So while all 3 might be great programs, only one of these listings gives the person who's making the referral enough information to confidently connect Maria to it, and also for Maria to confidently actually access this service. And so in these 3 listings that we've just seen, a weak listing really does equal a risky referral. When information is incomplete, our staff have a choice, and neither option is particularly good. They can either make an assumption and potentially send someone somewhere that they can't actually receive help, or they can decide to give the information anyways, which is not helpful to Maria. And for Maria, this means that she's wasting a trip when she's already dealing with such urgent needs. And on the other end of it, it works both ways. Better information doesn't just create a better experience for Maria, but it also means that your staff aren't spending time answering calls from people who aren't eligible for your services, explaining outdated hours, or just having to redirect people who were referred incorrectly. So ultimately, 2-in-1 is responsible for maintaining the resource database, but we can't know exactly what's happening inside every program in San Diego without our partners. And as we saw with the 3rd option, a strong listing is a confident referral. When our connectors don't have to guess and call your organization to clarify basic information, People like Maria know exactly where to go, when to go, what they're going to be receiving, and what they need to do to access the service. When Maria gets the right referral, she can access that service the same day. And that's what we're trying to accomplish with every listing in the database. And that starts with information that we receive from the organization who actually provides the resource. And so if you take away anything from this section of our presentation, we really hope that you remember that 2-in-1 manages the database, but our partners are who really make sure that it's accurate and updated by providing us with accurate information. And so the three main things that we really need from community partners is the what, the who, and the how. So the what does this program actually provide? Who can receive it? It's helpful if you're specific about eligibility and any requirements. And the how. How can someone actually access your service? Do they need an appointment? When can they come in? Can they just walk in? And any other pertinent information. And our resource team can take it from there. The strength of our resource database really does come from this partnership across the community. Okay, so now let's switch into how you can actually manage your information on the resource database. So if your organization is already listed with 2-in-1, you can request access to our partner community. And in our partner community, you can review your information, request changes, add services, and let us know when something should be deactivated. The process is pretty simple. You just request a login, make your changes, and submit them to us for review. And you don't even have to wait for us to contact you to do this. If something changes tomorrow, you can send us that update tomorrow. And this is what it's going to look like when you're actually in the partner community. So you can see other people from your organization who have access to the partner community. You can add a new service, and also you can just see all of your listings all together, including what's active, inactive, on hold, and when each service was last updated. This gives your organization one central place to see what 2-in-1 currently has on file. And once you open a service inside of the partner community, you can see exactly what 2-in-1 has published about your service. And this is where we want to encourage you to really read the listing as if you were someone trying to access the service. Is the information still accurate? And could someone understand it without already knowing about your program? If not, you can request an update from there, and the resource team will take it away. So when you are editing service details, there is a shared responsibility. While the resource team will take it from there, your role is to truly make sure that the substance is right, that your information is accurate, that it's clear, and that it's comprehensive. We want you to pay particular attention to the description, the eligibility, contact information, and your hours of operation. And the resource team's role is to take the information and make it consistent across our database. We have style standards, and we will apply the correct categories and taxonomies to make your service searchable in the database. And don't worry, you don't need to become an expert in how people search for resources or how we as 2-in-1 categorize services. You know your programs, and our team knows how to translate that information into something that can be searched and used effectively. So please don't worry about writing it the 2-in-1 way. Just tell us accurately how your program works, and we'll handle the structure. So after you submit a service, it comes directly to our team again, and our standard review timeframe is about 2 business days. If something isn't clear, we're going to follow up with you rather than just making assumptions. And once it's updated, you have the opportunity to review that information yourself. We require that services be updated annually, but annual is not the minimum. And it's also not the goal if your program changes throughout the year. So ideally, we hope that updating 2-in-1 becomes part of your normal process if something changes. For example, if you're changing your hours or opening a new location, changing eligibility, launching a new program, closing one, we hope that you think, let's update 211. And if something is urgent, you can email the resource team so that we can address it sooner. And with that, I'm going to pass it back to Nicole.
Thank you. Yeah, and the only thing I will add on is, our goal is to really reach out to all of our partners. We've got, 1,300 organizations and over 5,000 services that are available to the community right now. And, our team, we've got a team of resource specialists who are every day working on that database, cultivating it, making sure it's updated, thinking about it from the perspective of our agents, our partners, our clients, and making sure that it is, if they don't understand it, then no one can understand it. And so they're constantly paying attention to down to the minutia of how that's formatted and the consistency and the making sure that it is clear as possible. And so that partnership we have is so important, that we have contacts at all of our organizations. And also knowing that if your website is up to date and that is your source of truth, that's also really helpful information for us to know that we know that we can get there. And if you have that regular updates, like, you update your website at certain times of the year, that's also really helpful information for us to have. And we can leverage that so that, that we're maximizing the information for both our team and your teams. And so I'll shift gears a little bit here, and I really want to highlight an incredibly strong partner of 211 San Diego on many fronts. But our Jacobs and Cushman San Diego Food Bank partners are by far our most active and engaged resource database updaters. They have 189 services that are represented in the database today. And they've made more than 1,200 individual updates to the service profiles in probably about the last 8 or 9 years that we've had been in our system. And just this last year, there was 219 updates. It's almost like 5 times as many updates as any other provider. So they are by far our biggest champion when it comes to staying engaged and keeping resources updated. And so I would like to welcome Viana Villagomez from the San Diego Food Bank to share a little bit more about some best practices, talk to us a little bit about kind of what partnership has been from their perspective with 211. And we'd just like to pass it over to Viana, please.
Thank you, Nicole. Good afternoon, everyone. Yes, so my name is Viana. And just for a little starting context, we have about 10 different programs that the San Diego Food Bank runs food through, and only 4 of them are publicly listed through platforms and partners like 211. And we carefully selected those 4 programs for our agencies that we hold to a higher level of compliance, whether it's because of government contracts. We do have a program that's funded by the United States Department of Agriculture, and they specifically outline in our agreement with them that we have our sub agencies publicly listed on a web page, and they explicitly say at a minimum this will include a name, an address, and appropriate contact information. And they also specify that this should be updated annually, but they encourage to update it as frequently as possible. So that's a little why we probably have these great numbers. And I actually didn't know this until Nicole told me, but it's something that now I know we can be very proud of. And so yeah, the government part of things is one, but then we also exclude any of our programs that deal with children and some kind of like confidentiality in terms of location or schools or anything like that. Any protected classes we don't really include. And so that is a big part of how we're able to maintain the accuracy and how we're able to update these listings for the public. And I think part of why, as an organization, we put so much time into updating our resource information through 211 and our own website and some other outlets is also for reliability for community members. We really do pride ourselves on a certain level of like brand credibility or trust, I guess. And it's funky to think of nonprofits as having a brand. But really, when you want to be out in the community and you want neighbors to think of, hey, I know the San Diego Food Bank will be here on this day and this time, And 99% of the time, that's where they're going to be if they say that that's where we're going to be. So that's something that we really do pride ourselves on, and we do our best to train our team to also factor that in as, hey, we want to be a reliable source of security and safety and food for the community. Um, and then I would say best practices is our coordinators are trained to relay the message to all of our partners that are publicly listed to give a 40-day notice of any change in address, in hours, and days of distribution. And that gives our team plenty of time to go ahead and update everywhere where that agency is listed. So that 40-day notice sometimes isn't always followed. But it's a good standard to where when agency partners do tell us maybe 30 days in advance or maybe even 10 days in advance, it still gives us a buffer to update that information before the actual change happens. So that's one of the things that we implement or try to implement with our partners. And the other is real-time updates of these websites. So as I mentioned, we have several different platforms we publicly list our distribution sites at. One is 211, of course. We have our own GPS food locator map on our website, and we have rosters on several other websites. And so when a food distribution partner notifies us, a coordinator is tasked with sitting down and updating all 3 to 5 listings at once and making sure we touch base with I believe he is a resource specialist, is his title at 211. And he's been great, and we've built a lot of a great relationship over the last few years where it's, hey, we have this update. Can you please help us? Or we go into the portal and update ourselves most of the time. But if there's any nuance to it, then we'll ask for support. And then I would say the best part about it is, again, we've built that relationship with our specialist, and so there's a lot of accountability on both sides. So if 211 gets calls of, hey, actually the community member said they went here on this day and this time and no one was there, 211 is great about notifying us of that. And so then we can reach out to our partners and say, hey, what's going on? We had an agreement. Was it an emergency, or what's the situation? Likewise, we can let 211 know, hey, there's this listing and I'm not sure how it slipped through the cracks, but it's been up and this distribution has been suspended for a few days or a few weeks, which rarely happens. But it's a great accountability and collaboration between us. And because we're always emailing back and forth, um, I think that's what's made it easy to update so many of our listings. And then the last thing I'll say is something I kind of already touched on, which is maximum exposure for the community. When we talk about food as medicine and food as a basic need and a lifeline for people, it really is important for us to make sure that all of our listings are accurate to the best of our ability, of course, and make sure we do our part in ensuring that someone does feel like they can show up somewhere and receive the resources they need and go home and feel safe in at least that one aspect of life. Um, but yeah, that's a little bit about it. If anyone has any questions on any of our other practices or processes for updating or anything food bank related, I'm open. But thanks.
Thanks, Vienna. I really also will echo that collaboration and partnership is a two-way street. You know, I think the feedback we get from our partners, just to give feedback on, the referrals that are being sent over, whether they're strong referrals or if perhaps where there's a miscommunication, that information is incredibly helpful for us because then we can go back to the profiles, and if there's something that wasn't clear or could even, or we're missing a detail, like that's a really important thing for us to get that feedback on. And our team on the resource side ensures that we've got that information updated, and it's classified in the right way. And then if there's any other kind of feedback or coaching for our internal teams or our agents, we give that feedback as well. Because I think that feedback loop is what really helps us make sure that, that the information is accessible and useful for everyone. So that two-way street is incredibly important. And I know we've spent a little bit of time talking about, for organizations that are already in the database and how you keep them updated. But there's also lots of opportunities, and an avenue for folks and organizations that are not listed. And so if you are an organization that is already in the database, but you have more services that you think would be helpful to add, that can all be done in that same partner community platform. And we're always accessible by phone or email if you need a little extra support in getting your services added. But the other avenue is for organizations that are not yet included in the database. There's kind of a simple process to look for, and of course, our team is always able to help kind of walk folks through this in person, scheduling a meeting or over the phone. But essentially there's three things that y'all need to do. It is kind of check our inclusion policies. So those organizations that we have listed, we have a series of kind of policies and inclusion criteria to ensure that the agencies and organizations that are in the database that we refer to are vetted, are established organizations that provide social services to the community. And so there's an inclusion policy that's on our partner website that folks can look through. There's an application on the website, right? And we are in the process of making the application process a little bit easier. So for folks that have had any technical difficulties or find the process a little bit longer, we are working on making it just a simpler kind of request form. But either way, that'll be on our website, and that is kind of the first step, is to submit the application, provide information about the organization, and then either adding the service on the website right now, or we're working towards giving everybody a login kind of once the agency is approved, giving you a login so that then you can add your services directly in the partner community. But if anything is ever not clear and you're not sure if your organization would meet that inclusion policy, again, there's our resource center email information. It's also on the 211sandiego.org/partners site with all the same information to get people connected. I will shift gears a little bit and talk a little bit about our work, the 211 San Diego Work Ready Hub. And so this is, while we have our kind of the resource database that is searchable, and I'll show a little bit more about the search itself. But there's another way that we're trying to coordinate resources for the community in a slightly different way. And so the Work Ready Hub is essentially a way for 211 to organize resources to support the community that may be impacted by HR 1 changes in kind of federal policy around CalFresh and Medi-Cal. So the Work Ready Hub organizes resources around job training, employment preparation, education, volunteer opportunities that are available. And essentially these are services that might help support people in meeting new CalFresh work requirements. And so and I'll share the site in a minute here, but it's just like another way to organize that the resource database can be used to bring to different folks to the resources. Just so from our 211sandiego.org site, there's also the Work Ready Hub, and we will share out the slides. But the Work Ready Hub it's kind of organized. It's just some information about some of the specific CalFresh and Medi-Cal changes. We have more information about those, but the way that the site is organized is it brings together the way that the services are categorized. So every service, just like if you logged into your Netflix account or anything, you'd see your shows and your movies organized by category. We have the same mechanism in the database. All of the services are tagged with food, housing, employment, whatever those categories are. And that's really what helps kind of fuel the referral search in a way to keep it organized. And again, that's the work of the resource team in 211 to really ensure that that information is classified properly. But this is where it gets to be displayed in a more kind of user-friendly way. So for example, here we've got these services organized by like employment, volunteer, education. And so it walks you through kind of the categories and gives a little bit of a description of like, what is a comprehensive job assistance center, or what is job finding assistance? And it brings you kind of, with the view details, it brings you straight to the search itself with a curated list of resources that would meet that need. And so this is organized again kind of by those categories and brings you directly to the referral search. Just kind of glancing through here. When we are working on developing additional pages that have this more guided search. So for folks that don't know exactly what they're looking for, how to understand a category or the kinds of services, these sites are intended to kind of just make it a little more user friendly and organize it in a different way. So this is our referral search. And essentially our referral search is a way to access all those services that are in the database. And there's a couple different ways that people can search, whether it's by keyword. And then there's also the category search, which is what is how the Work Ready Hub is organized. And these are the categories, whether it's food, housing. Each of the categories have kind of a drill down, if you will. So you can start at the highest level and explore the resources based on category. And then services can also be searched for using a keyword search in any kind of specific organization that you're looking for, or just kind of a general phrase. And then there's also kind of additional filters on the left panel. And then there's a lot more information about the services that are going to show up on the right side of the panel. So right now I had gone from the Work Ready Hub. So it brought me directly to the comprehensive job assistance centers because that's what I'd clicked on. But the search can also be used to search for other kinds of services. So let's kind of clear out. We'll go back to like our homepage, if you will, where you have different of the more popular searches up at the top, and then some of the more commonly referred to referrals that are on the homepage. But if we were going to look for, let's say, a more specific search, maybe food for my family, and we wanted to put in a zip code for our office here, and then it'll search the resources. And so in the background, this is looking through all those 1,200 organizations, 5,000 services. And because we didn't go for the category search, we just typed in any kind of phrase. It's evaluating whether it's looking at the service description, it's looking at eligibility, and it's trying to determine what are the best resources that also serve that zip code. And if we put in a location, this is really where you get to sort it by distance, or you could choose to switch it or sort it by popularity. But what it does is it brings the most kind of the closest resource to the zip code up to the top. The service listings will have kind of your basic information about what is the program, eligibility, and kind of the best way to connect to that service. More information can be found by clicking on the more info. And even more information can be found if you click through to go to the service listing itself. But ideally, for folks, they can access services either, in either way, looking at category search or kind of browsing by category if you're not exactly sure what to search for. Back to my PowerPoint. And there's a kind of a little guide here that we have. Let's see. Second. So we have the guide here that is, that again, we'll have, just to kind of give you like the quick overview of how to search, that has like the tutorial of what I went through. So just making it a little bit more accessible for folks. And then kind of the last topic I want to bring up here is around our community information exchange. And so the resource database is one of the core components of our broader CIE effort. And so the CIE, if you have not heard of it, is essentially it is a larger ecosystem of providers here in our community. It's connecting health and social service and housing and other types of community providers to each other and for our network of clients. And so it's a model where our community members, our clients are opting into the CIE network to share their information for the purposes of coordinating their care. So that if they share their story or they want a referral to another organization, that information is shared securely with other CIE partners who have opted in to also do this work together. It's a way to not only bring together the community partners in the same space, but it's to use the same information, have a shared language, have the same resource database, integrating technology where we can, and really ultimately trying to coordinate care for our community in the most efficient way possible. And so the resource, among the 1,200 organizations that are listed in the database, we've got about 144 partners that are also a part of this larger CIE network. And, thinking about kind of the pathways here, you've got organizations that are in the database that maybe are not a CIE organization, but that's really where, we still have the information and we refer clients, whether or not we're telling them, we're giving them phone numbers or emails or addresses to connect. CIE offers another opportunity to have a deeper connection, a more perhaps electronic referrals and more of a case and care management platform. But ultimately, it's still rooted on that same information. It's predicated on having good, strong partnerships with our community providers, having accurate information about the resource database, having accurate information about how people can access services in our community, and really doing it in a coordinated way. So thank you all very much. We so appreciate you joining our conversation here today. We are kind of the key takeaways here is that our database, our ability to provide services is it's imperative to have these strong partnerships with you all, with the providers in our community. We need your support and making sure that information is up to date, it's accurate, and that we have that partnership in place. For organizations that are not yet listed, we want to ensure that the reach is out there, that we are connecting clients to as many providers that are able and willing to provide that support to our community. And when in doubt, we have a team of people here at 211 San Diego who are charged with building those partnerships and keeping your information and keeping our organizations up to date. So we are here and always able to support in any fashion. Thank you. I believe we're going to switch over to a little bit of Q&A.
Yes, thank you so much, Nicole, Simone, and Viana, for being our presenters and sharing your insights today. Adding on to what was mentioned about the Work Ready Hub, if you'd like to learn more about recent CalFresh and Medi-Cal changes, you may watch our telebriefing recording from last week, and that link will be shared in the chat and in the recap as well, following up on this webinar. We'll now move into a Q&A portion for this webinar. We'll first go through pre-submitted questions from registration, followed by live questions, and feel free to drop them in the Q&A box. And for questions that we're not able to get to, feel free to reach out to us, and we'll include the question and answer report in the webinar's follow-up communications. So we'll start with a few questions regarding connecting with 211 and systems navigation. Is 211 able to expand its outreach by offering presentations or workshops tailored to the audience?
So we often do offer different presentations to a wide variety of audiences, and we're also out tabling in the community a lot too. But if you have a specific audience in mind, or if you'd like 211 to present to your organization, please feel free to send us an email. And I also want to mention that we do have a community calendar of events. And in our community calendar, different organizations submit workshops, presentations, social gatherings, food distributions, things like that. And you can view our community calendar by visiting 211sandiego.org/events. Yeah.
Thank you, Simone. Our next question on that category is, how can organizations effectively support customers who are experiencing challenges reaching 211 operators or accessing 211 services?
So organizations can effectively support customers, I think, first by helping them understand the different ways that you can connect to 211 and to our resource database. So calling is one way to receive support. And I also want to emphasize that when folks are calling 211, under normal circumstances, usually the wait time is less than 2 minutes. So they are likely to be connected to one of our community connectors pretty quickly when they do call. And otherwise, another option is searching our online database or using one of our new web pages that was previously mentioned. We have our Work Ready Hub available that is filled with employment resources. And we also have a food page as well that folks can just click the links directly to find services. And then on the other end of that, if there has been a challenge with a certain referral, we really do welcome that information because it provides us a chance to connect with the organization and just ensure that their services are up to date.
Yeah, and I also just add, I think that not only having that partnership between, between our department and with folks that are experiencing those challenges, but people can call 211 and give that feedback. We have a very strong relationship with our agents. They're our biggest source, our biggest champions of kind of of sharing that feedback with us so that we can, we make sure we always follow up on that information. So lots of avenues to give that feedback.
Thank you, Simone and Nicole. Our next question is, what steps can an organization take to be listed or included in the 211 system?
Yeah, so the first step would be to review our inclusion policy that you can find on our website. We want to make sure that you meet some of our criteria, which includes being free or a low-cost service, being legally established, and also available to the public. And after you've confirmed that you meet our inclusion policy, or if you're unsure if you do, you can also send us an email. But once you confirm that you meet our inclusion policy, you can submit your application with information about your organization and your services. And from there, the resource team is going to review it. And once we approve you, you will receive access to our partner community, and you can also begin submitting your services on our partner community as well.
Thank you so much. We will move to our questions regarding best practices about informing oneself about service systems. So what should new San Diegos know about local service systems, community needs and delivery pathways, and any existing gaps in order to support resource providing organizations and community members?
So I think that new San Diegans should know that our local service system is made up of very wonderful resources that address a wide variety of community needs. And also that our service system is very robust and collaborative. We have different organizations from nonprofits to healthcare providers to community groups, food pantries that are really working to meet the needs of San Diegans. And with that being said, we also know that oftentimes need does exceed the availability of resources, which I think goes back to the point of why accurate and up-to-date information is so pertinent. Just to ensure that we have those strong referral pathways, because we know that not one organization can meet every single need of every single San Diegan, but together through partnership and coordination across organizations, all needs can be met.
Thank you so much, Simone. The next question is, how can community members access immediate housing assistance programs? And what community supports are available to help residents navigate local systems and connect with essential services?
Yes. So we know that housing is one of the biggest needs in San Diego, and housing needs are often urgent. And also on top of that, the availability of housing resources can change pretty rapidly. So one way that community members can access immediate housing resources is by, again, calling 211. Our community connectors can help identify any available shelters, rental assistance programs, rapid rehousing programs, affordable housing, homelessness services, anything that's really based on the person's specific situation and eligibility. And our community connectors really work with callers to identify their specific needs when it comes to housing.
Thank you so much, Simone.
And
Those
I
were our
might
please.
and sorry,
go
I might
ahead.
just add in two more pieces to that. I think that it's also, and while resources may not always be available for everyone, I think that's a big part of both, our community connectors' job is to understand the client situation and think about other programs or services that might also be helpful to supplement or to, as another avenue. And so the same thing, it's not both in the database searching online or calling, that I think that's I think that is someone putting like that's the importance of kind of the collaboration across sectors to think, creatively and strategically about what resources there are potentially available.
Thank you both. I'll now be going through some of our questions that were submitted live here. One of them has to do with the topic of systems navigation for 211. And the question is, can we access the resources even if we're not registered as an organization?
Yes, totally. Sorry, I'll let you add, Nicole.
Oh, yeah, absolutely. I mean, I think that the website is always available. There's always information. 211 is 24/7, 365 in any language. And I think that, the search itself is available on the website, but you can and happy to provide additional, insight into it. But the search can be customized. You can add in a specific zip code or city, so you can get kind of a geographically centralized list of resources. But yes, all the resources that are in the database are always available, always publicly available, and either online or over the phone.
Thank you. Our next question is expanding a little bit more on the community information exchange. The question was just, can you share a little bit more about the community information exchange?
Yeah, of course. So, and I probably spent a whole hour talking about what the CIE is, but it's I think I'm still sharing my screen, right? Let me see if I can go back. So, when we talk about what the community information exchange it really is, it's many different things, but a part of it is a way for our San Diego community to share information about both about community resources, but collaborate on and care planning for clients. And so the model really is based on community partners kind of joining the CIE network and being an actual partner who is a part of the network, who signs agreements, who ensures that they have kind of the legal requirements and join the network from a more from that perspective. And then we also have clients who opt in. So they are opting in to share their information. And so those folks are a part of the network and can access services, can have electronic referrals be shared across the community. But it's more so that it's creating an ecosystem so that this can all happen within kind of the same most efficient manner. So it's a variety of different kind of facets to it, but it's predicated on partners that are sharing information. It's clients that want to have their information shared and their care coordinated. It's the same resource database, and that it is kind of creating that shared language and shared system for effective coordination.
Thank you, Nicole. We have another clarifying question about one of your other slides regarding the Work Ready Hub. They also wanted to learn a little bit more about the Work Ready Hub and its purpose.
Yeah, of course. And so Work Ready Hub is essentially a way to create to organize resources related to job employment readiness, job training, volunteer opportunities. So it's created a partnership with the County of San Diego as a way to help support folks that might be at risk of losing their CalFresh or Medi-Cal benefits. So as federal policy changes are happening and people may drop off benefits for CalFresh or for Medi-Cal over the next several months, unless they are able to meet some of those work requirements, we created this site as a way to just centralize resources and make it as easy as possible for folks to find opportunities for job training, find job boards, find career preparation centers, volunteer opportunities, basically the things and the services that potentially could help connect people to the services that can help them meet work requirements, and just kind of created it in an organized way. So it is accessible from our website, 211sandiego.org/work. But it is essentially an organized list of all the services that are in the database. So this is one route of getting that to those providers like San Diego Workforce Partnership, Hands On San Diego, Goodwill Centers across the county that are providing those kinds of services.
Thank you, Nicole. Still a question on a Work Ready Hub. When did this Work Ready Hub launch, and are there plans to continue promotion for the Work Ready Hub?
Yeah, so we launched it in June, this past June, and it is things like opportunities like this is how we can help promote it. I know the County of San Diego and many of the other meetings and webinars were promoting it in those places. The County of San Diego's Access Line and Eligibility Workers, HHSA, as they are connecting with clients who may be impacted, they're also providing the information over to the work to 211 and to the Work Ready Hub. So there's a lot of different avenues. And then, and especially for organizations that are on this webinar or hear about it, I think sharing that information as it's relevant in your networks and your communities is also an incredibly important part of getting kind of the word out.
Thank you so much. One last check for the Q&A box. Our question, still on this topic, would you say it's best to assist the individual with the Work Ready Hub or allow them to navigate how user-friendly is?
I think in any fashion, so let me navigate back to pull it up again. So the website itself, hopefully is user-friendly. It organizes resources and gives kind of some descriptions about the kinds of services that are available. So I think that the goal is to make it kind of as user-friendly, but can always call 211 for more coordinated support. Again, our community connectors, our agents are there 24/7, 365 to help connect people, ask the right questions, think about eligibility, think about location, and some of the details that, of course, our team is trained to know to ask. So I think that, in either fashion would be very appropriate.
Thank you so much. I appreciate the demonstration and everything. We have a couple of more minutes for the Q&A section. So I know we've gone through and we'll wrap them. If there's any last minute ones you'd like to add to the chat, that would be the time, or the Q&A box. That would be the time.
Yeah, I do see a couple other questions about presentations. And I think that, yes, we often do that, and we're happy to, to provide that, to go to the communities, go to the schools, talk a little bit about, the resources that are available, and just in general, share more about, 211. And so I think definitely reach out. We're happy to connect and find opportunities.
Thank you so much, Nicole. And we will get our screen back up to the previous slide, but we appreciate everything with the demonstrations and having you navigate your slides. So thank you so much. We really appreciate it. Okay. Thank you, everybody, for being presenters today. Before our announcements, we ask that you let us know what you thought about this webinar and information presented. We'll add the link to the chat, or you could scan the QR code on the screen to complete a short feedback form, and we'll take a few moments to allow time for feedback. Thank you to those who wish to participate. We'll leave this up for a few minutes before our closing. And thank you, everybody, for participating in our feedback. And thank you again to the 211 team for your partnership and leadership. For upcoming events, we have a youth networking event in mid-September on the Science for Community Impact. And in October, we have a hackathon kickoff nature and wellness fair. More details to come, and you can scan the QR code for more information. This page will be updated with today's recording as well. And links shared by presenters on the slide deck will be included in the follow-up email. That's our time together, and thank you so much for joining us, and we look forward to connecting at future advancement throughout the year. Thank you, everybody.
Thank you all.